Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to my channel. This video, inshallah, we will talk about medical position and its uses. Let's start with the supine position. Supine position meaning it is a back laying position with arms on side. And the uses is physical examination and resting and undergoing in anesthesia and lung biopsy. And the second is a prone position. Prone laying on the abdomen with head turned to one side. And the uses is to prevent aspiration, recovery position after anesthesia, and to relieve pressure on the back and the coccyx, and renal biopsy and neural tube defect. Dorsal recoupment, position in which the position lays on the back with the lower extremities moderately flexed and rotated outward. Vaginal examination and the bimanual palpation and the perineal care and the pelvic examination and prepare for lesions following. The Trent-Burke position. The body is laid supine or flat on the back in the 15-30 degree, include with the feet elevated above the head, and this position it's important when the patient have a hypotension. The uses of this position include shock position, hypotensive patient, and cord prolapse, and the air embolism, and the surgical radiations of an abdominal hernia. The lateral position. There are two options, the right lateral recoupment or the left lateral recoupment. And lateral or side laying position, the position lays on one side of the body, either the left or the right. The uses of this is to promote lung and cardiac function, to relieve pressure on the back and coccyx, and after liver biopsy, and pyloric stenosis during the seizure attack and the air embolism. After that is the Simmons position. Simmons or semi-prone position is when the patient has a posture halfway between the lateral and the prone position. The lower arm is positioned behind the client, and the upper arm is flexed at the shoulder and the elbow. The upper leg is more actually flexed at both the hip and the knee. Then is the lower one. This picture describes that. The uses: rectal examination and the administration enema to prevent aspiration, and the low Fowler position. In this hand of the bed is elevated at the 30 degree with flexion at the level of the waist. Uses: to prevent aspiration during tube feeding and during increase the intracranial pressure. And this position, Fowler's position, is the head of the bed elevated at the 45 degree with the flexion at the level of the waist. The uses is to promote lung expansion, to relieve tension following abdominal surgeries, tracheoesophageal fistula, and to paracentesis. And this is a high Fowler's position. Is in this head of the bed is elevated at the 90-degree with deflection at the waist. And the uses to prevent risk of shocking, to relieve respiratory distress, the nasogastric tube insertion, and the asthma, COPD, chronic obstructive pulmonary disease, and the emphysema. And this is the orthopedic position, places the patient in a sitting position or on the side of the bed with an overbed table in the front to lean on and the pillows on the table to rest on. And the uses is to relieve respiratory distress, to the tracheocentesis, pericarditis, and acute respiratory distress syndrome, asthma, and COPD, and the emphysema. Lithotomy position. The patient is on their back with hip and knee flexed and thigh apart. And the uses vaginal examination, childbirth, and to the knee chest position. Knee chest position can be in lateral or prone position. In the lateral knee position, the patient lays on their side. Torso lays diagonally across the table. Hip and knee are flexed. In the prone knee chest position, the patient kneels on the table and lower shoulders on the table, so chest and face rest on the table. The uses of this position is sigmoidoscopy and the lumbar linoscopy and the rectal examination. The kidney position. The patients assume a modified lateral position wherein the abdomen is placed over a lift in the operating table that bend the body. Patients is turned on their contralateral side with their back placed on the edge of the table. Contralateral kidney is placed over the break in the table or over the kidney body elevator if attachment is available. Then the uppermost arm is placed in a gator rest at no more than 90 abduction or flexion.